2022. The elections are just around the corner here in Kenya. Please vote wisely. Please vote wisely. Vote for a leader that you wouldn't mind your child or your fourth generation emulating. I go by the name Sarah Ayuma, the oral nutritionist, and if you haven't yet, please click the subscribe button below to boost my YouTube channel algorithm. And remember to stay tuned for matters fashion, for matters beauty, for matters elegance, for matters fitness, for matters money, diet, budget, sex, religion, among other life topics. If you've subscribed, thank you for your continued support. Thank you for your continued support. Please remember to share, like, comment on these videos and other videos of your choice, and also practice what you've heard me speak about. I can assure you that it will not let you down. This is the 6th episode of Sarah's Etiquette series, and today we are going to discuss about the preconception timeline, the preconception timeline, and diets, maybe for men and women, because it takes two to create a baby. It's not just a woman's job. By the way, let me ask you, who determines the sex of a child between a man and a woman? Please comment down there if you know, if you're sure, or with your suggestion about who determines the sex of a child between a man and a woman. I'd like to know your views. I'd really like to know what you think about that. So this is my sixth episode of Sarah's Etiquette series, and today we are going to discuss about the preconception timeline, and maybe some of the things that are helpful or should be avoided just before pregnancy. Basically, I'm going to elaborate actions and that will make one fit for a healthy reaction called pregnancy. I'm going to talk about actions that will make one fit for a healthy reaction called pregnancy, because pregnancy is a reaction of one's action. So I'm going to talk about actions that will make one fit for a healthy reaction called pregnancy. Stay tuned to the end of this video and find out my bonus tip on this etiquette episode. I'm going to share a bonus tip on this etiquette episode, so stay tuned to the very end of this video. Remember, I have been there before and I've gotten pregnant. So I've been there and I've done that. So don't change your dial. What should you do 24 months before? This is the time when you can be watching your BMI or body mass index. And what should you aim for? Okay, body mass index has a lot to do with one's weight and height. You'll find out that tall people who are big or who are massy, who have a big body mass, have a good BMI compared to short people who have a big body mass. You'll find out that tall people who have a big body mass have a good BMI compared to short people who have a big body mass. So what is the ideal BMI that you should be aiming for 24 months before conception? The ideal BMI is between 19 and 25. That is very, very okay. So 18 months too, you should be visiting a gynecologist for some pap smear, pelvic, and breast examination. Remember, in one of my previous videos, I mentioned that having sex in marriage is costly. So it's wise to get some money first before starting such visits, because they're not cheap. Gynecologists are not cheap. So just wait until you have your monies before you start thinking about having babies. So 12 months before conception, one should check their fish consumption and limit it to 340 grams per week of low mercury fish. 340 grams per week of low mercury fish. That should be your fish intake 12 months before conception. 9 months before conception, it is advisable to visit a dentist so that any dental problems can be identified and treated. I have had cases where people identify dental issues during their pregnancy, which, during pregnancy, it's not advisable for you to do any dental treatments that are harsh, or even treatments, even removing your tooth during pregnancy. So please, 9 months before conception, make sure you visit a dentist so that they can identify any of these issues, and dentists are not cheap too. I went to wash my teeth that's the other day, and I was told that it would cost 5,000, and my teeth are okay, by the way, they're just discolored. All right. So if washing can cost 5,000, what about any other dental issues that need to be treated? Of course, then cost more. So that's why I keep saying get your monies first before thinking of getting married, because getting married comes with having sex, and having sex comes with such costs, especially when you want to get a child. All right. Um, so 8 months to conception, this is when you should start your physical exercise, regular physical exercise like gymming and what have you. 7 months before conception, um, it is highly advisable that you stop your coffee consumption and avoid drinks with caffeine, because caffeine together with tobacco smoke are associated with anorectal atresia in newborns. This is a severe congenital anomaly with their anus and rectum. It's a severe congenital anomaly with their anus and rectum. So avoid caffeine and areas that will make you a passive smoker. You might be having friends or relatives that smoke. If you know that you want to conceive, if you know that you want to conceive 7 months before, please avoid being in environments that will cause you to be a passive smoker. Avoid caffeine, avoid coffee. If you not you know get anything out of this point, but just get this, that 7 months before conception, avoid coffee because it might lead to anus or rectum issues in your fetus, right? And also, if you're a smoker, this is the time to stop smoking completely. Stop smoking completely. I do not advocate for smoking or drug abuse, but you see, people use different substances, and some people will not even tell you they're using until issues start popping up in their children. That's when they'll start saying, and I was a smoker, or I was in smoking environments, and what have you. So 7 months before your conception, please avoid caffeine, please avoid coffee, and also avoid environments that will result into you being a passive smoker, because you might end up with a fetus that has anal or rectum complications, right? 6 months before conception, one ought to start multivitamin and mineral supplements. 5 months before conception, one is to take a general health preconception check, which includes HIV tests. Guys, look, you might evade, taking HIV test, STD test, and just choose to enjoy your sex life however you want, whenever you want. But trust you me, it will catch up with you. So being careful will not cost you anything, but being careless will cost you a lot. You know, 5 months before, and I want to just insist on this point, because even during when you get pregnant, you still do these tests. You'll do the HIV test, you'll do the STD test, okay? And another test that I will advise that you do is the hemoglobin and red blood cells count. You should do this 5 months before conception. You should also do the electrophoresis, which you know uh, gives a more detailed report about your red blood cells and how they appear or look, or if they have any deformity or anomaly. All right, the electrophoresis, I know, costs about 25,000 Kenya shillings. Guys, this is why I keep insisting that you need a lot of money before getting married. So get your money. Another test that you ought to do is your iron test. You have to do the rhesus factor test, the RH factor test, and any other fetal determinant test. Why am I insisting on this? Because sometimes you can say, I'll just get pregnant blindly, but hapo mbele, something comes to eat you up. Something about, you start having miscarriages because of rhesus factor issues, or you create babies that don't have enough blood because your red blood cells were not okay, or any other thing. These STDs, they affect children. By the way, you can give birth to a child with eye complications because you had an untreated STD. So these things, don't take them lightly. I've been to hospitals. I've been pregnant myself and given birth. So I've been to hospitals because of various tests, and I know what I'm talking about. It costs you nothing to do these tests 5 months before conception. And please also go with your husband for this test. Go with your husband for this test, because you're two different human beings. I hear there are HIV carriers that will not show if they are HIV positive. So they only infect other people. So please, 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 5 months before conception, do HIV test, do a STD test, do hemoglobin test, do electrophoresis, do the rhesus factor test, do the iron test, do any test that might affect your fetus in any way, and because you're responsible for carrying a healthy baby. If anything is within your powers to carry a healthy baby, please take that initiative, because ignorance is no excuse. So 4 months before, you should stay away from smoking cigarettes. Stay away from smoking cigarettes. For this may decrease your levels of fertility. And staying away from smoking cigarettes includes also men. All right. Men, if you smoke cigarettes, you're decreasing your levels of fertility. Please, ladies, if you smoke cigarettes, you're decreasing your levels of fertility. So what am I saying here? 4 months before conception, please stay away from smoking cigarettes, both you, the wife, and the husband. 3 months before, one should start taking the folic acid and vitamin B12 supplements and also one should stop the use of contraceptives. 3 months before, one should start taking their folic acid and vitamin B12 supplements, and also stop the use of any contraceptives. Uh, if you are taking alcohol 3 months before, please stop taking alcohol, because alcohol causes folic or folate deficiency. Alcohol causes folic or folate deficiency. So 3 months before, stop your alcohol use, because alcohol reduces the causes the folate deficiency. Folic and multivitamin prevents birth defects like spinal bifida. Have you heard of spinal bifida? Children who are born with spinal cords that have issues. Taking folic acid and vitamin and multivitamin also prevents cleft lip. Cleft lip is a lip that is lifted like this. Yeah, you give out to a child who has a lip like this. If you take folic acid and multivitamins 3 months before, you'll prevent cleft lip. You also prevent oral facial clefts. All right, you'll also prevent oral facial clefts. So you are advantage. You do yourself a service, not a disservice, a service, by taking folic and multivitamin, and also avoiding, how can I put it? Avoiding alcohol, because alcohol will definitely taking alcohol will definitely reduce your folate. Taking alcohol, sorry for that. Taking alcohol will reduce your will cause folate deficiency. Taking alcohol will cause folate deficiency. So 2 months before conception, avoid exposure to X-rays. Avoid exposure to X-rays. Avoid exposure to X-rays 2 months before. Avoid exposure to X-rays and or any other sources of ionizing radiation, unless the pregnancy test that you've taken is negative. So 2 months before, avoid exposure to X-rays. Right? If you want to do X-rays, do them way before 2 months, and avoid those things that have avoid ionizing radiation 2 months before conception. Thank you for staying till to the end of this video for my bonus tip. And here it comes. Should you take any medications 1 month before pregnancy? Should you take any medications 1 month before conception? The answer is yes. The answer is yes, as long as those medications are okay with pregnancy. All those tips all those tips that I've talked about above are within our human scope. And I mean, these are things that we can do before waiting on the Almighty God to bless our womb with a fruit. All right? These are things that we can do before waiting on the Almighty God to bless our wombs with the fruit. And these are things that God will not do for you. Things like exercising, God will not do for you. Things like eating right, stopping smoking, God will not do those things for you. Men, remember to eat antioxidants because they will make your sperm swim faster. I'm basically talking about fruits and vegetables, particularly brightly colored ones like berries, mangoes, spinach, carrots, tomatoes, red pepper, etc. Guys, men, I'm talking to you right now. If you can, include any of this in your diet before, making another woman pregnant, making your wife pregnant. Sorry for that, making your wife pregnant. That that's what I meant by another woman. I meant your wife. Before making your wife pregnant, please eat berries, please eat mangoes, please eat a lot of spinach, please eat carrots, please eat tomatoes, please eat red pepper, red bell pepper, right? And many other brightly colored fruits and vegetables because they are antioxidants and they are going to make your sperm swim a bit faster. And that's it from me. Stay safe during this electioneering period and see you in my next video. Adios.